Assalamu alaikum everyone, it's me Javeya Jabeen and welcome to my YouTube channel. Today we will discuss about the blood supply to the long bones. But first of all, have a look on structure of long bone. The structure of long bone includes a cylindrical central shaft which is called diaphysis, and the elongated ends are called epiphysis. The intermediate segment which is present between the epiphysis and the diaphysis is called metaphysis. In the upper part of metaphysis, a growth plate or an epiphyseal cartilage is also present. The articular surfaces of epiphysis is covered by articular cartilages. The articular cartilages provide an attachment between two different bones at the joint. The non-articular surface and you can say the rest of the bone is covered by a thick connective tissue which is called periosteal. There is a foramen, or foramen is a canal or a passage from where the blood vessels enter into the bone. This foramen is present at the middle part of the diaphysis and called nutrient foramen. Now move to our major point of interest, which is blood supply of the long bone. Some main examples of a typical long bone includes humerus, radius, ulna, femur, tibia, fibula, metacarpals, metatarsals, and like other bones. A typical long bone receives blood supply from many arteries which include epiphyseal arteries, metaphyseal arteries, nutrient arteries, and periosteal arteries. We will discuss them one by one. Number one is nutrient arteries. The network of nutrient arteries is a high pressure network. It means that the blood passes in a high pressure in the nutrient arteries. The nutrient arteries enter into the diaphysis by nutrient foramen. In the medullary cavity, the nutrient arteries divide into the ascending and descending branches. The ascending and descending branches further divide into smaller lateral and parallel oriented radial branches. The radial branches supply blood to the bone marrow and third part of the compact bone tissues of diaphysis. The ascending and descending arteries further are continuously divided, and in the ends of the bone it forms small spiral branches. The small spiral branches then anastomose with the metaphyseal arteries or epiphyseal arteries. Second network of arteries, metaphyseal arteries. The metaphyseal arteries enter into the metaphysis at the margins of joint capsule. After entering into the metaphysis, it fuses or anastomoses with the spiral nutrient arteries. This fusion makes the metaphysis a vascular rich area and helps in the development of the bone and in the growth of the bone. Number 3 network is epiphyseal network. The arteries enter into the epiphysis by periarticular arcades. These are the passages from where the arteries enter into the epiphysis, and then in children, epiphyseal arteries and metaphyseal arteries are separated by the presence of a hyaline cartilage or growth plate. In an adult bone, the hyaline cartilage is replaced by bony tissues, and metaphyseal arteries and epiphyseal arteries fuse together, which makes the ends of the bones very vascular. In some epiphyseal points, the epiphyseal arteries enter into the epiphysis and then cross the growth plate or epiphyseal cartilage to supply blood to epiphysis. This type of artery which pierce or cross the epiphyseal cartilage is called juxta-epiphyseal artery. But in some epiphyseal points, the arteries enter through arcades and provide blood to the epiphysis directly without any piercing or crossing. The fourth network which provides blood to the bone is periosteal arteries. Around the bone, the most upper layer, the protective layer, is called periosteum. In the periosteum, the periosteal layers enter at the epineurosis. What is epineurosis? Do you also think? Epineurosis are the thin connective tissues which helps the muscles to connect with the bones. At the attachment sites of epineurosis, the periosteal layers enter into the periosteum and it further extends and enter into the bony tissue of diaphysis through Volkmann's canal. The Volkmann's canal is a canal which provides a passage and which provides a connection between periosteum and bony tissues or Haverian systems. Haverian system is the unit of bony tissue, you can say. The layers enter into the bony tissues and it supplies the blood to one part of the bony tissue of diaphysis. The one part of bony tissue of diaphysis receives the blood from periosteal arteries and the remaining three parts receives blood from radial branches of nutrient arteries. This is how the blood supplies to the bone. Now we are going to discuss the venous system of the bones. The veins the arteries carry oxygenated blood towards the bone and veins carry deoxygenated blood away from the bone. The veins are present side by side the arteries. All the deoxygenated blood of the bone is drained into the central venous sinus, which is then drained out of the bone with the help of epiphyseal vein, metaphyseal vein, nutrient vein and periosteal vein. I hope you will surely understand about the blood supply of a typical long bone. Complete comprehensive overview, let's come with me. A typical long bone receives blood from main arteries network. The epiphysis receives blood from epiphyseal arteries, metaphysis receives blood from metaphyseal arteries, and diaphysis receives blood from diaphyseal arteries, and periosteum receives blood from periosteal arteries. Periosteal arteries also supply blood to some part of the diaphysis compact bone. And all these arteries, when supply blood to the bone, the bone uses the oxygen and the deoxygenated blood is then drained into the central venous sinus, and from central venous sinus the blood is drained out of the bone by epiphyseal vein, metaphyseal vein, nutrient vein and periosteal vein, which are present side by side the arteries. Thank you so much. If this video is helpful for you, so must like, share and subscribe. See you in the next video. Bye bye.